Good day, everyone. My name is Ezekiel, a final year student at U of R, and I'm majoring in health studies. I'm currently doing my fieldwork at the Pasqua Hospital, Accountable Care Units, which we call the ACU. The ACU, unlike any other traditional care model, fosters a better teamwork and relationship between the healthcare providers, which includes the doctors, nurses, social workers, dietitians, and physios, and also provides a better relationship for patients and families whilst they are in the hospital. My title at the ACU is a quality improvement student, where I analyze the performance of the team through a data collection and provide the efforts to improve the team's performances. I'll jump straight and talk about my special projects. So I was working on a patient whiteboard on a 3D unit, and as we all know, the patient whiteboard serves as an important communication tool for patients and families whilst they are in care. And the whiteboard contains valuable information such as the goal of the day, and the discharge plan, and the tests and procedures that a patient have within the day, and also the name of the patient's doctors and the name of the patient nurses and all of that. So I started this project on October 20th to December 10th. And the units 3D were not doing too good when it comes to patient whiteboard updates. And as a result of that, the objective and the goal of this project was to, figure out the challenges and the barriers, just so we can come up with strategies for quality improvement. I believe this project is valuable to patients and families that are in care because, before I started this project, I did a literature review on the previous studies that have been done on the whiteboard. And according to the study, 96% of the patients found the whiteboard very useful. 93% of them read the whiteboard every day. And over 80% of the patients check the goal of the day, the tests and appointments that they have within the day, and the names of their healthcare team. I developed a lot of professional skills and knowledge when working on this project, which includes interpersonal skills, communication skills, teamwork, and a lot of technical skills. This is because the research methodology that I used for this project was survey and RedCap, which is an online survey. But due to, the busy nature of the nurses and the healthcare team, there wasn't a lot of people who did the online survey. So I had to be on the unit on a regular basis and engage with them. This practice demanded a lot of confidence and, communication skills, as I had to approach a group of nurses and doctors and, pharmacists and explain to them what the project is about and also get them to partake in it. And as I mentioned, technical skills was very much needed because I had to convert the raw data into useful information and also develop a performance metrics and the results based on the survey and present it to the unit leadership for quality improvement. Honestly, I feel like everything worked the way I expected it to be because obviously it sounded very intimidating working on a unit and engaging with the team, knowing very well it's a busy, time, especially during COVID. I felt like they were busy and, being on the units on a daily basis were kind of hard for me personally, and it was challenging in the first place. But at the end of the day, it wasn't too bad because I had over 52 participants partaking in the survey. 20 of them were patients, 22 were nurses, 3 were doctors, 2 were social workers, and 2 were pharmacists, 2 were dietitians, and I had 1 physio. The most valuable experience I gained in this project, I would say, is the feedback phase, where I had to present all the results to the unit leadership and the quality improvement team. I feel like, presenting this, the work that I've done and delivering it to the leadership team, it made me kind of feel some sense of accomplishment, as I never imagined to excel through this project, especially considering the fact that the hospital were putting restrictions and, guidelines in place. I think that will be the end of my presentation, but I feel very honored to be part of the quality improvement team at the Pasqua Hospital.